Okay, thank you. Right. Okay, well, we're going to go ahead and get started. Welcome, Prince George's Community College. Welcome to our session where we're going to be, well, it's actually our Friday forum. We do this every Friday where we just kind of talk about different types of topics. But this Friday is special. We're going to be discussing heart disease and healthy heart health for all of our students and their family members, because we realize a lot of students are home and living with family members who may be older and who may be prone to some of the issues that we're going to be talking about as it relates to heart health. And so you might want to pay attention for them or for yourself. Learn about some healthy habits to keep yourself healthy. Learn about some healthy food choices and learn what you can do to create a healthy lifestyle, your heart in mind. So, with today being National Wear Red Day for Healthy Heart, we decided to put on this program today. So I am Dr. Danielle, one of the counselors. We also have other panelists who are going to be discussing um, various issues related to healthy hearts. For example, we have our two nurses, Nurse Ann Eric, who is a registered nurse in our wellness center. We also have our other nurse, Nurse Arnita Shelton, who again is a registered nurse within the Wellness Center. There I am. I am, again, Dr. Danielle LaTour Bryant, one of the counselors, and I'll be moderating this session. And then we have Mr. DeVell Kent, who is also one of the counselors in the Wellness Center. So we welcome you all, and we'll go ahead and get started. If you have any questions, feel free to put them in the chat. Mr. DeVell is going to be checking that. So as questions come up, we'll definitely answer those. Let me give you an example of the agenda for today and what you can expect to hear about. Our topics of discussion will include, hi Winnie. Our topics of discussion will include looking at symptoms of heart attacks and or stroke, looking at how COVID-19 impacts heart health. We're also going to be talking about the impact of stress, and not only stress on the immune system, but also on heart health and the impact of substance abuse. Certain drugs are more prone to mess with the heart. And so we're going to be looking at some of those. And then we'll end this by looking at some healthy food choices, particularly fast food choices, because, you know, it's easy to go to Chick-fil-A and just order whatever. But here you'll learn how to maybe make some more healthy choices and still be able to go to Chick-fil-A. We'll go ahead and get started with that. We'll start with Nurse Ann, who's going to be telling us a bit about cardiovascular disease, healthy heart, symptoms of heart attack, things of that nature. So, Nurse Ann, please take it away.
Okay, well, thank you. I think what was the most surprising to me when I looked into the issue of cardiovascular disease is that it does affect young women. We do think about the fact that older people, our parents, grandparents are affected by it, but young women also. As the first point there, that it kills more women than cancer, and that is very true. In fact, the fact that it is not, as I said, an old person's disease, and younger women can be affected. So one woman dies every 80 seconds, and again, can affect at any age. it is the number one killer of Americans. And as it comes to the younger age group, African Americans between the ages of 18 and 49 are twice as likely to die from a cardiovascular disease than whites. And in the Latino population, there is at least 40% of Latinos over the age of 20 that actually do live with cardiovascular disease. The other reason that it's so broad, cardiovascular disease, is because we also need to consider the fact that people are born with certain cardiovascular diseases, what we would call congenital diseases. And we also know that, there is some things that you can't change in your life. And that would be one of those things if you were actually born with a cardiovascular disease, or again, if your family was at high risk for cardiovascular disease. You can see what our next slide says. Yes, so what are the risk factors? Again, the high blood pressure, obesity, smoking, stress, family history, which we really can't change that. But the other factors we certainly want to work on. And when we describe cardiovascular disease, it is the most common process of the fact that your arteries harden, or they call it atherosclerosis. And that is just the building up of cholesterol and plaque and blockage, in the arteries. And what contributes to that would be the fact that we have certain amounts of cholesterol in our body. And of course, that leads into good and bad cholesterol. And when we talk about the good cholesterol, we again want to describe that as our the high density lipoproteins. So that's our good one. And then the low density lipoproteins is the one that we consider to be the bad cholesterol that can lead to the plaque formation and the hardening of the arteries, which again affect all parts of the heart and the vessels, and also lead to the common cardiovascular situations we're going to describe a little later. So diabetes and cholesterol, with the presence of diabetes, that's also can be a factor. Again, that's the way our pancreas deals with insulin. And we know that there are two types of diabetes, one in which it is a type 1 diabetes, which is a condition that can even affect children. Children can have that chronically, and another one where it seems to be developed as we are living in a situation where our diet is not as good as it should be, where we're not moving around as much, where we have much more of a sedimentary lifestyle, and that's the type 2 diabetes, which we find primarily in people in their middle lives, but it's just soaring in this country because of just our lack of exercise and our eating habits. So cholesterol and diabetes definitely contribute to our cardiovascular diseases. And as we said, some of the things that we're going to talk about to help with that is going to be the food, reducing stress, and certainly the fact that we want to have regular exercise. So, yep, we're going to talk about the heart attacks, and we're going to talk about stroke, because of the fact that those are two things that we know that if you experience them, or you know someone that is experiencing it, you can immediately call 911. Certainly, a lot of things build up to having a heart attack, and a lot of things build up to having a stroke. And again, those are the explanations we gave about the fact that there is the hardening of the arteries and cardiovascular disease and ways to prevent it. But the two things, if we identify them and we see them occurring, The sooner that we call 911 and the sooner you're at the hospital, the better it is for you to be relieved of a heart attack and a stroke. So, for our signs of heart attack, it's described with the uncomfortable pressure, a squeezing, a fullness, a pain sensation in the center of your chest, pain or discomfort in one or both arms, the back, the neck, the jaw, or the stomach, shortness of breath, which again, we've seen people short of breath because they have difficulty speaking. Um, and you can break out in a cold sweat, nausea, lightheadedness. Now, for men, those are certainly symptoms as well as for women. But women, for them, it can present a little bit differently, where not always is it going to be chest pain. Certainly it can be, certainly that is a part of it. But sometimes the pain or the pressure may be in the lower chest or the upper abdomen. We still see the pain in the jaw, the neck, or the upper back. Nausea or vomiting can also be a part of what you see with women, the shortness of breath, fainting, indigestion, and extreme fatigue. So, again, any of this can be presented in both men and women, the kinds of things that we just mentioned, but particularly we sometimes see a little bit more of what I just mentioned for women. As far as the signs of stroke is concerned, once again, 911 is still something you want to call right away because there is treatment that can be given if you get to the hospital right away. And that would be a sudden numbness or weakness of the face, the arms or legs, especially on one side of the body, sudden confusion, trouble speaking or understanding, sudden trouble seeing or blurred vision in one or both eyes, sudden trouble walking, dizziness, loss of balance or coordination, a sudden severe headache of an unknown cause. And again, both men and women can experience this. Some additional symptoms for women would be general weakness, again, a disorientation and confusion or memory problems, fatigue, nausea, or vomiting. As we said, for these main cardiovascular problems, you never need to worry about whether you're determining whether it's a heart attack or a stroke. Which is it that I'm experiencing? Or which is it that, someone I know is having? Or what is that person complaining about? Could that be a heart attack or a stroke? Clearly, whatever is happening, whichever kind of symptoms that are being presented, if it necessitates the calling of 911, that's the most important thing that you would want to do. So I would say again that as it relates to cardiovascular disease, it is something that can be present at all ages. Thank you.
Hey, thank you, Nurse Ann. That was very informative. Very informative. I'm wondering if there are any questions. Maybe not at this point, but we'll certainly come back because you may have spurred something down the road. So thank you for that. I appreciate that.
Yeah, you're welcome.
Okay, so and Devel also put that in the chat. As we hold off for questions, there is a video that we can play that illustrates some of the things that you were talking about, Nurse Ann, in terms of how heart disease or cardiovascular disease affects younger women. We actually have a video of one of our younger faculty members who's talking about the impact that it's had on her. So if you give me a moment, I'll go ahead and pull that up.
Bill, and I'm an English professor here at the college. And excited about the Wellness Center hosting this event about heart health because a lot of times as younger people, as young adults, we think that we have so many years before we have to think about all of that type of stuff. But the reality is now is the time to think about it.
Uh-oh. Okay, well, it looks like I can't get Verizon out here. So, um, unfortunately,
As obviously infertility is one of them.
okay, so I'm told you don't hear or see the video. So I'm hearing and seeing it all by myself. Okay, I so apologize for that. So what we will do is I'll definitely make that available. Um, I'm wondering if we can perhaps put that in the chat. Perhaps we can find the link and put it in the chat. So from there, what we'll do is we'll go on back. Nurse Arnita, hello. Are you ready to join us? Thank you, Devel. All right. So Devel just put the link in the chat. Fantastic. Hello, Nurse Arnita. Okay, well, what we'll do is we'll go ahead and pull up the our next slide. So the next thing that we're going to be addressing is how COVID-19 has impacted the way in which individuals access healthcare, particularly the fact that it has caused some individuals not to visit the doctor. I don't know about some of you, but I've been seeing ads on TV that talk about if you're having certain symptoms, don't wait, go to the emergency room or go to the doctor. Because apparently there is some hesitancy out there of individuals wanting to get the help they need because they're afraid of getting COVID or contracting COVID-19. I know that my own doctor takes precautions and ways in which to keep me safe in the office. And I know I've seen her now twice, every 6 months. So I've seen her twice this time, and there are protocols in place. So for those of you who may have some trepidation or some uh, hesitancy about going and seeking medical care in this age of COVID, I would say um, to make sure that your health is a priority. And if your health is a priority, then that means finding out if something is wrong, whether COVID is in our community or not. Um, is there anyone else who would like to contribute to this particular topic?
I just have to agree with you. Even for not just heart related issues, but people are delaying surgeries. At first, they couldn't get the surgeries because of the fact that they weren't trying to do any kind of surgery unless it was really absolutely necessary. But now that there are a little bit more abilities to, get there's certainly considered to be surgeries that maybe you didn't need immediately, but they were still necessary. I think people are still, trying to hold off. I mean, I think of, again, certainly something that would involve the heart that maybe is not just, well, if you don't have this, you're going to have a heart attack in a day or two, but, something that that would be beneficial for overall cardiovascular health.
Yes, definitely, definitely. And so perhaps in terms of even looking at when you were talking about the types of symptoms, if you're having any of those symptoms, it would be good to check out with your physician.
Absolutely, yes. We don't have to wait for 911. That's for sure.
Right.
Yeah,
Correct.
we absolutely don't have to wait for that. We're just trying to, make the distinction as we always do about the immediacy of treatment.
Right.
If you're in that, but you're absolutely correct. If you're having any of these kinds of symptoms and they don't appear to be of an immediate, they certainly need to be checked out. Absolutely.
Definitely. Yes. Shortness of breath, going up the stairs, and just telling that to your doctor. They can listen to your heart. They can do a stress test. There's all sorts of things they can do in the office to kind of give some idea and some context to what you might be experiencing.
Yes.
Okay. Okay, so let's see. We're going to try the video again. So let's switch hands. And Devel, would you like to bring up the video on your end and play it for us? Once we return from the video, then we'll look at some different risk factors that we can actually control. Looking at the impact of substance abuse on heart health, as well as the ability to be able to make some healthy food choices. I see that Nurse Arnita has joined us. Nurse Arnita, is there anything you'd like to say? All right, looks like we're getting the video together. Excellent. Yes, I can see the screen. Can't hear it. All right. Oh man, I'd really like to hear you, Stephanie. I know, Winnie. Yeah, I know. We're trying to get it together. Okay, well, um, we were able to put it into the chat. The link is in the chat. So feel free to perhaps visit the video on your own. It is on YouTube. So it will be available for you to view even after our presentation. So thank you, Devel, for putting it in the chat. At least we have it there.
Sure, no problem. I think the volume it was recorded might have been a little low because I had my
Okay.
to the highest capacity.
Yeah, yeah. All righty. Well, with that said, Devel, do you want to lead us in the discussion around the various risk factors such as, stress and drugs and the impact that that might have on heart health?
Absolutely, absolutely. The first place I want to start out with is stress, and I want to clear up. I want to clear up a little bit about stress, and basically with stress, how it correlates to the heart is through the temporary spikes in blood pressure. And again, when you have stressful situations, physiologically, it can elevate your blood pressure. And so it doesn't mean that stress will cause a diagnosis of high blood pressure, but experiencing stressful situations can spike your blood pressure. And what we know is elevated spikes in blood pressure can cause heart attacks. So that's one of the reasons why it's very important for us to learn different ways to reduce our levels of stress so we won't experience those spikes in blood pressure that could put us at risk for potential heart related consequences. So definitely when we get to the segment of what are some ways that we can be a little more proactive and healthy with our behaviors, we want to definitely make sure that we look at managing our stress. So I wanted to start with stress. So again, the spikes in blood pressure is what puts us potentially in danger. So say that you are experiencing stress in excess, day after day, hour after hour. What that's doing is that's putting wear and tear on the function of the heart, pumping the blood flow. So with these high blood pressure spikes is what can cause us to have these issues. So I wanted to start with stress because a lot of people may not make the correlation between heart health, heart attack prevention, and stress. And so again, anxiety doesn't necessarily mean you're going to have a diagnosis of high blood pressure. But when you experience panic attacks, anxiety attacks, or just stressful situations, you can experience high spikes in blood pressure, and depending on how long that lasts and how much you experience that could really be a detriment to our livelihood and our heart health. So with that being said, I want to transition to another subject that's under drug abuse, and that's alcohol. A lot of people don't understand that there is a direct correlation with alcohol use and heart negative impact. And what that correlation is when you drink in excess. So when you are an abuser of alcohol over time, what that does is it can impact your heart rhythm, which can increase possible heart attacks. So drinking is very common all around the world. People don't think that alcohol is a drug, but when you abuse alcohol and when you use alcohol in excess, it can have negative impacts with your heart, which could make you a candidate for a heart attack. Now, we all know that smoking and heart disease and heart related issues is a well-known fact. So it's just a reminder that regardless of what you're smoking, if you're vaping, if you're smoking tobacco, if you are utilizing drugs that you smoke, same scenario, this increases your chances of having a negative impact in the livelihood and the functionality of your heart, and ultimately could result in some type of heart failure or heart disease. Now let's talk about some other drugs. When looking at drugs like cocaine and crack cocaine, those are stimulants, and stimulants definitely raise your heart rate. So when you use drugs that are going to raise your heart rate, and when you deal with life in general, it puts you in a greater chance and an increased chance of having a heart attack, possibly having a stroke, and having negative impacts on your heart. Then there's something called opiates and opioids. Okay, real quick. Opiates are drugs that are derived from the opium poppy plant. Opioids are synthetic opiates. So these are manufactured opiate opium derived drugs that are made in a lab or in a pharmaceutical lab. So that's what opioids are. Some opiates are morphine, opium, of course, heroin. Opioids, oxycodone, hydrocodone, and a few others. The thing with opioid abuse is that the opioids can slow down your heart rate. So excess use of opioid drugs can slow down your heart rate. So popping these pills, drinking what they call lean, in excess of that can slow down your heart rate. It can dilate your blood vessels, which lowers your blood pressure, which ultimately can result in failure of your heart. If your blood pressure goes too low, we're going to have problems. If your heart rate goes too slow, you can ultimately have problems. And our medical experts, our nurses, could probably qualify and talk about that a little more. But slowed heart rate and excess using of drugs, slowing down your blood pressure, not a good mixture. Then there's another set of drugs that are called benzos or diazepines. I always get tongue tied with that. And those are your Valiums and your Xanax drugs, which are other drugs that are popular in various communities that are used illegally and in excess. The thing about using the benzos is it creates abnormal heartbeats. So imagine utilizing these drugs long periods of time, high volumes, and having abnormal heartbeats over long periods of time, it puts you in a situation which could increase the probability and possibility of you having heart related issues, which could ultimately cause the end of one's life. The other direct issue with heart problems with heroin is through injecting heroin, because when you inject this drug in the way that people utilize the drug, there's bacteria that is created. And so the individual is constantly injecting bacteria into your bloodstream, which creates blockages in your heart, which ultimately has a negative effect and a deadly effect on your heart. So although we may think that smoking, drinking, some people have differing opinions on utilizing drugs. The overall goal is these particular behaviors and items increase your chances of risk factors.
Well said, DeVal. Well said.
Thank you. I know that was a lot of information chunked in a small amount of time, but I wanted to make sure I gave you all I had.
Oh, yeah. Always thorough. Yes, the quintessential therapist. Thank you.
Thank you.
Yes, good stuff. And particularly as you went through the various categories of different types of substance abuse, whether it's recreational, whether it's prescribed, whether it's illegal. Wonderful way to frame all of that, and the impact that it ultimately negatively has on our heart health.
Absolutely. Absolutely.
Okay. All righty. So we have given you the definition or the some background about what makes a healthy heart. We've looked at causes and symptoms of when you might be having heart problems and what that might look like. We've looked at the prevalence of how different types of cardiovascular disease can show up in different types of communities. We've looked at the impact of COVID and how that has prevented folks from seeking help, and how we are advocating that you look past that, because medical attention is necessary when it comes to preventing heart disease, and for it also developing into later stages. So with that said, now we're going to look at what we can do to maintain a healthy heart. We're going to look at what we can do with food choices. DeVal also mentioned the catchphrase healthy lifestyle. And so we'll all be able to contribute to that. So I'll go ahead and get it started, where we're going to be discussing making good food choices, particularly when you're out and about. Now, surprisingly, even though we have the pandemic and there are limited places to go, fast food restaurants have not closed down. They have closed down, and business hasn't slowed down. And so it can be very helpful then for us to know, if we're going to these places, what would be the healthiest choices for us at particular times. That's all. Granted, I know it's hard to go to Chick-fil-A and not get the waffle fries. I know. But maybe you get the waffle fries and then you get a grilled sandwich. But I'm getting ahead of myself. Let's look at some healthy choices for breakfasts, particularly at grab-and-go places. So, as you see on the screen, there are a variety of choices, and what they have in common is the idea of you're getting protein, you're getting some fiber, And that all helps to keep the body chugging along, which means the heart is pumping along very well, and it's being able to use the type of fuel that it needs, proper fuel, not junk fuel, that it needs to keep going. So, even what is that? A Panera ham, egg and cheese sandwich. There you have your protein with the ham and the eggs. You've got the fiber with the multigrain bread, and they probably put something green on there. It's Panera, who knows? Also with these are the portion size. So you're not going to get 3 of the Panera ham, egg, and cheese sandwiches. You're going to get 1. And I especially see that healthy choice there from Starbucks, which is the oatmeal. And what I can is that, yep, it is oatmeal, whole grain oatmeal. Starbucks oatmeal is probably about $5, $6, maybe even $8. Mm-hmm. You buy yourself some Quaker oats. It takes only 8 minutes to cook. Trust me, I know because I use my timer. 8 minutes to cook. Put it in a little coffee mug, and you've got your own for pennies on the dollar. Those are healthy choices for your heart. So. And the other thing is breakfast. Start out the day with breakfast so that your heart doesn't have to work as hard to keep going. Give it the fuel that it needs to keep going, just like a car. We all know with cars, we run on fumes. And when we're running on fumes to get to that gas station, we're kind of nervous. We're kind of worried. Am I going to make it? I hope I don't, run out of gas. It's the same thing with our bodies and with our heart health. So we want to fuel it and not run out of gas. So that's breakfast. How about some lunch? Here are some healthy lunch choices as well. And it runs the gamut. I'm looking at everything from McDonald's to Arby's to Subway to Chick-fil-A to Wendy's. To the In-N-Out burger, which we don't have In-N-Out around here. That's a West Coast thing, but some of our students might be familiar with In-N-Out. So there's even a choice there for you. And of course, at Chipotle, you can build your own. The thing with building your own of anything, whether it's a salad bar or whether it's at Chipotle, are the ingredients. So you want to use the healthiest kind of ingredient. So you want to go for things that represent the rainbow. Okay, so the salad, the greens in the salad, the radishes, or the carrots and the tomatoes and the cucumbers. You want to go light on things like cheese, or things like oil, or things like sour cream. Yeah, those are colors of the rainbow, but they don't necessarily go with healthy heart health. So if you can, instead of a dollop, maybe a teaspoon, if you have to have it. If you don't have to have it, leave it off altogether. So those are the types of healthy choices that you can make. Of course, there's always the idea of drinking water. Nurse Ann talked about the hardening of the arteries, and certainly drinking water can, I would imagine, would help to keep everything running and flowing smoothly. Our bodies are, I think, 98% water, and so water helps to keep us regular, keep us regulated, body temperature, all of that, and healthy heart flow, blood flow. So those are just food choices. I invite the wellness staff to chime in terms of other healthy lifestyle choices that we can make to protect our heart.
Well, as we always know, it's that wonderful exercise that we all, some people have some really good habits with exercising, and others need to kind of put a goal and start with a small amount. Walking, as has been well known, is something we all are able to do, and is a good form of exercise.
Mm-hmm. Definitely, Nurse Ann. And I think uh, the recommended allowance for exercise is 2.5 hours per week. So that's almost like 30 minutes, 3 or 5 times a week.
Mm-hmm. That sounds right.
I think that's such a very important point in general, but specifically since we are in this remote environment, and because we are in this, well, because a lot of people, everyone might not be participating in a remote environment by choice, but for those who are subjected to being at home for long periods of time and working from home and going to classes from home, it can cause you to get very lax in your creativity and being mobile. And so one of the things that I share with students is, how you're at work and you are allotted 15-minute breaks throughout your workday. If if you're having classes at home or you're working at home, give yourself periodic breaks and just get some fresh air. If you and then mix it up. If you are bored with the walking or bored with the outdoors, you can do some core activities. You can do some home workouts. It doesn't have to be extensive. It doesn't have to be over the top. It could be anywhere from 5 to 10 minutes, as long as you're having a consistent routine of doing something and breaking the consistency of just sitting, or the monotony of just being in front of the computer. Do different things. You could do some meditation, you could do some breathing exercises, you could do some journaling, you could do some drawing, you could talk to loved ones. But you definitely want to get mobile, because it's so easy to be in front of the TV, to be at home, and what one of my older siblings would call have a snack attack, where you're just doubling down and you're eating snacks all day. And then let's keep it real, you know, not the most healthy snacks, cookies and chips and candies and all of those little sweet things and ice cream. And you find yourself making that a normal habit, whereas though that might not have been what your routine was when you were on the go. So you just want to be mindful of that. And, the healthy lifestyle is physical and mental, and you have to combine the both. You have to combine both and infuse both. So as Nursan said, and as you mentioned, along with that, you definitely want to get your blood flowing. And that's another thing that's good for heart health. You got to get the blood flowing. You got to get the heart pumping. So if you're not into jogging, just go ahead and do some walks. But you gotta get out of the corner. You gotta get away from the TV. You gotta get out of the bed. Because again, I know how it is. You get used to being at home. You start your class laying in the bed, and you find yourself there the half of the day. And so, you just want to make a little schedule for yourself. Nothing extensive, but you want to make a schedule for yourself to make sure that you are getting some mental and physical exercise, and be creative with it. Be creative with it. And so that's my spiel on that whole healthy lifestyle segment.
Mm-hmm. That's a great spiel. And the only thing I would piggyback off of that would be with the exercise thing. I remember speaking with a student the other day, and the E word came up. And I said, I think exercise gets a bad rap, because I asked her, I said, do you like to dance? And she said, yeah, so such and such, come on, I turn it up. I said, that's exercise.
Yeah, absolutely.
So you put on 2 or 3 of those songs, you dance through them, and you're done for the day. And you had fun, and your mood is elevated. and you did something healthy for yourself. So, exercise doesn't necessarily have to be so regimented, where you're just, sweat pouring and you're exerting yourself. No, no. It's just about, as you said, Devel, using the word movement. That's all you want to do. You just want to move. And the other thing to piggyback off of is the snacking. One of the cultural is I've found with cardiovascular health has to do with African Americans. Um, uh, we as a population, we tend to have genetic makeup where we might retain more sodium. And so if some of us have that type of predisposition, snacking on salty things is not good for the heart. Am I correct, Nurse Ann?
Yeah, certainly that is correct. And we also always love to emphasize the facts of natural foods, fruits, vegetables, and as you said, just to build your salad with lots of color.
Okay. So you might want to watch the saltiness, particularly if you are Black or African American. You might want to be more prone to find out about your family history, because sometimes you could be sailing along and something genetic could come up to kind of throw you off your game. So find out about family history. Ask grandma or ask auntie or uncle, about some of their health issues or health conditions, just so that you can get context. All right, so it looks like we are coming to the last few minutes of our time. Is there anyone that wants to have any final words before we end today?
Okay.
I believe, there we go. I was going to say one of our participants has a comment to make. Please, by all means.
Go right ahead.
Hi everyone. My name is Winnie. I'm a student in at the college. I'm majoring in nursing. I'm doing RN program. I am an LPN already, so I'm trying to get my RN. So I'm just want to thank you for putting up with all the good work with the wellness program today. I just want to say I've got a lot of things to learn. So thank you so much.
Oh, thank you, Winnie. You're very welcome.
Yeah, thank you.
A future nurse, so she's going to be carrying on this information. That's fantastic. Fantastic. All right. Well, with that said, I will thank everyone for their participation today. Thank you, Nurse Ann, both of our nurses from the Wellness Center. Thank you, Winnie, for even coming off mute and speaking. Sometimes students are hesitant about that. So thank you so much. Devel, definitely appreciate your behind the scenes work, but also that information that you shared with us in terms of healthy heart and substance abuse and the impact that can. Let me see, I don't think I have any other slides. Nope. Our next program will be February 16th, where we're going to be talking about teen dating, violence, and abuse. And we have some guest speakers who will be on the panel as well. So there'll be more. Look out for that information in that link. So thank you again for joining us today. Enjoy the rest of your day. Bye-bye from the Wellness Center.